So with that, David, welcome.
Thank you, Susan. Thank you, Stuart. It's wonderful that you all are helping sponsor this meeting. Both of you deserve a lot of credit for the leadership you have exerted over many years in the healthcare sector on many topics, including the one we're discussing today. Information is really the lifeblood of medicine. Any practitioner, whether you're a nurse or a physician or a hospital manager, you realize that you're only as good at what you do as the information you have about the patients you serve, about the populations you serve. Health information technology in the 21st century is destined to be the circulatory system for information in healthcare. In other words, it is the lifeblood and the force behind improvement. It's been a privilege for me to be at this place and this time, a time when we are thinking about radical change in our healthcare system, and also for the first time seriously contemplating the creation of an information system that can support that change. The federal government was tasked with providing leadership in the health IT area, and we have endeavored to do that. My office, the Office of the National Coordinator, working closely with the Center for Medicare and Medicaid Services, and one of the first manifestations of that has been a series of regulations implementing incentive programs and other programs that are, I think, going to be vital to letting the circulatory system of our healthcare system work effectively. Though the federal government is offering leadership, it cannot make this program, this work, sustainable by itself. Actually, the hard lift takes place not in the federal government, but in hundreds of thousands of physicians' offices and thousands of hospitals, and we hope at some point nursing homes and patient homes around the country over decades to come. The wonderful thing I think about the meaningful use regulation that the Center for Medicare and Medicaid Services published and that we were privileged to advise on is that it provides a framework around which all those efforts can align. It is, if you will, a roadmap, a conceptual framework, a set of measures that have been carefully processed, carefully considered through thousands of public comments, many public hearings, much discussion and debate, and which well-intended individual providers, well-intended payers, well-intended systems can use to align and organize themselves. And that is a very powerful opportunity for a healthcare system. It is, however, only an opportunity if those who have the privilege of leading in the private sector pick up the baton and run with it. Changing the healthcare system is a team sport, and we want to build a team to make that possible. And I think you're going to watch today the beginning of that team taking shape, the beginning of the leadership originating in the private sector where we need it to make meaningful use and effective information systems the foundation for a better, more efficient healthcare system in the future. So thanks again to Susan and Stuart and to our colleagues from the private sector for being here. And let me welcome Marilyn Tavener, a great partner in this effort.